We're here with Bob Cushman, Senior eHealth Consultant at MEDSEEK at the HFMA ANI show. Bob, tell me, based on your conversations with providers and customers at the show, what sort of financial challenges are they facing and how is MEDSEEK helping them to overcome those challenges?
You know, I think everybody's talking about the ACO framework and how they're preparing for accountable care. And one of the primary focus points in accountable care is this concept of eventual patient activation. A lot of organizations right now are looking at contracting and how they're going to manage risk, how they're aligning with their physicians, and how they're planning for facility transition. But we don't want to lose the point of the patient in this process, because ultimately it's all about the patient. So what we've been doing is talking about our patient portal solution technology to a lot of the providers here, and trying to prepare them for that digital inevitability, if you will, as they start engaging their patients more formally. I think one of the other key areas that we're talking to providers here more specifically about is really point of service and payment. Everybody's paying their bill over their phone. You hear about the digital wallet, you hear about the online bill payment. Everybody uses online banking these days. So how do you prepare that patient really within a patient portal framework to start to use that bill pay function as a convenience item? A lot of organizations are also dealing with what they call out-of-pocket estimation. So if I'm a patient and I'm now in a high-deductible health plan, how do I go online to find out ultimately how much something's going to cost for me? Be it a tonsillectomy or a colonoscopy or even something like plastic surgery, if you will. So we've put together a product called eCost, which allows a patient to actually go through the eligibility process to determine what their actual out-of-pocket costs are going to be. So I can pull out my insurance card and say, you know what, if I'm going to go to hospital A, at the end of the day, my hospital fees are going to be exactly this amount, be it $1,800, $5,000, or whatever the case may be. So we've got a lot of interest in the whole the whole cost estimation process, partly because it gets ready for that point of service collection process as well. So it's been a really good show so far. We've got some really good traction. It's interesting to see all the other business development going on as well. There's a big talk about analytics and cost analytics and how we're going to manage risk, and so we've had a lot of vendors come in and talk to us about that. I'd like to also comment today, we had a press release go out this morning about our new relationship with Diebold. You may know them from the ATM at the bank, but we're working on a partnership with them to now have a ATM, if you will, or a kiosk in the hospital, so that just like you check in at the airport, you can now check in at the hospital and begin that whole registration process right when you walk in the door.